In this video, we will talk about pregnancy problems that pregnant women may experience, such as premature birth, pre-eclampsia, gestational diabetes, and others. What is meant by pregnancy problems? Pregnancy problems are problems that cause miscarriage, premature birth, or a woman suffering from a difficult pregnancy. Pregnancy and premature birth problems are linked to maternal and newborn diseases and deaths, as about 7% of all pregnant women experience premature birth. Pregnancy problems are often associated with several factors, including women who suffer from pre-pregnancy diseases, women who are pregnant with 2 or more fetuses, women who develop diseases discovered during pregnancy, women who suffer from a defect in the structure of the uterus. The danger in the occurrence of premature birth lies in the possibility of the birth of a fetus that has not fully developed as it should in the womb yet, which may lead to a variety of diseases, and even to the death of the fetus. It is worth noting that 20%–30% of women who experience premature birth also have an increased chance of premature birth in future pregnancies. Major pregnancy problems. Problem number 1. Ectopic pregnancy. In an ectopic pregnancy, as it is called, the fetus develops outside the uterus and is a common pregnancy problem. An ectopic pregnancy is usually in the fallopian tubes, because the fertilized egg did not complete its journey from the fallopian tube to the uterus, which often happens due to blockage or inflammation. Since only the uterus is suitable for the development of the fetus, an ectopic pregnancy usually causes complications, as an ectopic pregnancy poses a risk of rupture that can lead to a large amount of blood loss. So, an ectopic pregnancy can pose a life-threatening risk. Only 2% of pregnancies occur outside the womb, and the vast majority of these cases do not end with childbirth. In cases where the fetus develops, it must be removed by caesarean section, because he is unable to reach the birth canal. Problem number 2. Gynecological diseases. There are certain diseases in a pregnant woman that may harm the fetus, as well as there are diseases that may worsen during pregnancy and after childbirth, such as heart disease or high blood pressure, hypercoagulability problems, associated diseases that affect many body systems, such as kidney disease, and neurological diseases, autoimmune diseases, endocrine diseases. Therefore, there is a need for specialized follow-up and appropriate treatment to reduce these pregnancy problems resulting from these diseases. Problem number 3. Preeclampsia. Preeclampsia affects about 5% of pregnant women, and it is one of the pregnancy problems that lead to premature birth, miscarriage, or bleeding in the brain of the pregnant woman, leading to coma or even death. Preeclampsia involves an increase in maternal mortality and morbidity, as well as an increase in fetal and neonatal mortality and morbidity, especially as a result of premature birth and slow growth of the fetus in the womb. In recent years, it has been noted that the incidence of botulism has increased as a result of the increasing age of women involved in pregnancy, and an increase in the proportion of multiple pregnancies due to fertility treatments has also been recorded. Symptoms of preeclampsia are as follows. High blood pressure. Here refers to women whose blood pressure was normal before pregnancy. Loss of protein in the urine due to damage to the kidneys. Swelling of the body, especially the extremities. To save the mother, doctors may deliver her if this phenomenon occurs in the late stage of pregnancy. Problem number 4. Gestational diabetes. Diabetes is a common pregnancy problem, and it is divided into 2 main types during pregnancy, namely pre-gestational diabetes, which is diabetes that was known to be present before pregnancy, gestational diabetes, which is diabetes that appears only during pregnancy, and about 5% of women suffer from it, and it usually disappears after childbirth. In both cases, the pregnancy should be monitored with the accompaniment of specialized doctors. Gestational diabetes is usually detected by a glucose tolerance test, and is managed by follow a strict diet, Use insulin if necessary. Complications of gestational diabetes. Complications in the mother and fetus due to gestational diabetes can be divided according to the different stages of pregnancy, as follows. Stage during pregnancy. These are the possible complications for the mother and fetus. Complications for the fetus: increased miscarriage, birth defects, premature birth, intrauterine growth retardation, obesity, fetal death in the womb, and amniocentesis. Complications in the mother: severe disorders in the balance of sugar, placental abruption, and the occurrence of high blood pressure. Birth stage. These are the possible complications for the mother and fetus. Complications in the fetus: increased risk of fetal distress in fetuses with growth retardation, and painful labor in cases of fetuses with accelerated growth. Complications of pregnancy for the mother: long and sometimes painful childbirth, and an increase in the percentage of cesarean deliveries. Postpartum stage. These are the expected pregnancy problems for the mother and fetus. Complications in the newborn. In the short term: low blood sugar levels, persistent neonatal jaundice, increased blood viscosity, low levels of calcium, and delayed pulmonary maturation. In the long term: increased incidence of obesity in childhood and adulthood, higher incidence of diabetes in adults, and possibly other developmental problems. Complications in the mother: the need to stay in the hospital for a longer period, exacerbation of diabetes, and neurological problems. Problem number 5. Toxoplasmosis. Toxoplasmosis is a disease caused by a parasite that usually lives in the intestines of infected cats as well as in the cells of other animals. Toxoplasmosis is one of the causes of pregnancy problems. The disease can be contracted as a result of direct contact of the mouth with cat feces, eating contaminated meat that has not been cooked properly, work into the ground and touch the hand to the mouth. In pregnant women, this disease can lead to pregnancy problems and fetal deformities, especially if the mother is infected during the first trimester. If the parasite passes to the placenta, the disease can cause a miscarriage. However, many people become infected with toxoplasmosis during their lifetime, and as a result develop antibodies against this parasite. Women who have antibodies in their blood are immune from reinfection, and a blood test can detect the presence of antibodies. Problem number 6. Cytomegalovirus. CMV causes a life-threatening disease in fetuses, and infection occurs through contact with secretions from an infected person. This virus usually causes mild symptoms of mononucleosis, or symptoms similar to those of the common cold. However, CMV is one of the most common pregnancy problems for fetal intrauterine infection, occurring in 0.5%–20% of all births. Also, a pregnant woman who becomes infected with this virus may experience a miscarriage. Most fetuses who become infected with CMV during pregnancy are born healthy. But in cases where they are, the disease appears with symptoms as follows: intrauterine growth retardation, brain injuries, calcifications in the brain, eye injury and deafness. It can also cause enlargement of the liver and spleen, skin rashes, and jaundice. How can pregnancy problems be reduced? There are a variety of abnormalities, which pose potential risks to the pregnancy. So, a high-risk pregnancy requires close medical follow-up more frequently than a normal pregnancy. Proper preparation reduces pregnancy problems and diseases for pregnant women and their babies. However, it is important to stress that many pregnancies known to be at high risk end in healthy babies.